So you also see how the scar is changing. And that change of the scar is really, really important, because this is one of the things that we are always highlighting for the families, that we, in our culture, underappreciate the skin, absolutely underappreciate the skin. We tend to think, when we look at this kind of images, like this vertebra, we tend to think, okay, so this is the body of the vertebra, and then within this body of the vertebra, then you've got these different things which are sort of hiding there, right? So you see you've got this cover here, then it would be this ligamentum flavum. So somewhere here is that supraspinal ligament, right? And then in between there is the intraspinal. So you see this kind of ligaments there. But on the other hand, what are the ligaments? If you look at them from that, the ligaments, they're much more being the ingrowths of the skin. So, and in that respect, you can see the spinal processes more the ones which are being kind of the reinforcements that belong to the skin, and the entire series of ligaments could be seen as the one that comes out from the skin. So in that respect, when the skin is damaged by the surgery, we really have a trouble, because you see, so where you can see how the tissue slides, and this is where we can see this control. So that's a really critical thing to understand, that actually it's the active muscular part that moves under the stabilizing skin. So therefore, when the skin is damaged, this process is reversed. So it's like, indeed, the skin tries or becomes like the part which has to move over the muscles, but that's not the way it's supposed to be. So that's why the body blocks it. So as we feed the skin, as we get this connection, as we improve this competence within the skin, that improved competence of the skin then opens up the opportunities for the rest of the internal tissues to actually perform. See, with ABR Fascia Gel being consistent and regular with the applications of those, so you see the Fascia Gel has these bioactive ingredients which feed that network which supplies it there, right? Right? The scar itself becomes a lot less fused. There is a lot more kind of space, breathing, opening in that skin, and therefore for the muscles which are attached underneath, right? So you see, that is a very, very important thing. So when you look at this image, you should see it the other way around, right? Not the skin sitting on top of the muscles, but actually the other way around. The muscles sitting inside the skin. Whilst, of course, on the other side, the muscles are connected to the bone, right? And as they're connected to the bone, so that forms what I call the sandwich of control. So between two stationary parts, the attachments, the periosteum of the bone and the inner surface of the skin, the muscle is then being constrained. So therefore, it can move in a predictable fashion. What we do with ABR, right? If you kind of get back to this understanding, we don't really do so much for the muscles, right? Let alone we don't train the muscles in any kind of active fashion. But we wake them up. Once we woken up the edges and the attachments, the muscles are actually coming alive and coming active by themselves.